Welcome to another episode of Health Hour. I'm Toni Preckwinkle, President of the Cook County Board of Commissioners. We're excited to be with you as we talk about the most important issues of the day, our personal health, the health of our communities, and our fight against COVID-19. Our guest today is Dr. Claudia Fegan. Dr. Fegan joined the Cook County Health and Hospital System after 15 years of private practice in my neighborhood with Hyde Park Associates in Medicine. She began her career with the county as the medical director of our ambulatory care center and has since been promoted. She's now chief medical officer at Cook County Health. Recently, Dr. Fegan was awarded the Soul of Medicine Award by Physicians for Social Responsibility for her work inspiring medical students to commit to careers in social justice. She was also the 2017 recipient of the Paul Corneli Award for her work as a healthcare activist. Dr. Fegan, welcome.
Thank you. Glad to be here.
All right, listen, I just want to ask you, first of all, how did you come to be interested in medicine and particularly in public health?
So my interest in medicine started in high school. I was a good student and was interested in biology, and my teachers encouraged me to consider medicine. They said, you could really make a difference. And making a difference was always important to me. Public health was was after I had actually finished my training and was out in practice and realized how much of a difference physicians can make in the lives of their community. I realized that physicians only teach patients how to take care of themselves. They don't actually take care of patients per se. And I realized if I was teaching my patients in the exam room and I could help that patient, what a difference I could make if I had something to say about how we provided care to other, in the other exam room. Maybe a little bit of a megalomaniac, but I thought that we could help patients do better if we had certain guidelines, if we could just change the way in which we talk to patients. And so teaching patients how to take care of themselves would allow us to teach our communities how to do better. And so it was a natural transition to me to public health.
Now, your family has also been committed to social justice. It's both, you're interested in medicine, I think, in your family background that maybe led you to this. Is that correct?
Oh, that's absolutely true. My parents were definitely activists, definitely interested in making a difference in our community. My parents were involved in demonstrations and civil rights from the late 50s all the way through the 60s. And we had people come through the house like Martin Luther King and Paul Robeson, and we're always trying to make things better for everyone. So the idea of that I could have a life work that would allow me to make a difference in the community was really a value that I had been raised with. And the idea that you weren't just taking care of that one person, but the entire family and the community that person was a part of resonated with me and has for a very long time.
All right, let's shift to, I think, what is on everyone's mind these days, and that's the vaccine. How is the vaccine rollout going in Cook County?
We're doing well. I think as we have really ramped up to have tremendous amount of capacity, and the more vaccine becomes available, the more people we're able to vaccinate. So just on Monday, we expanded our capacity even more, so that people who are, we started with people who are over 65 and with healthcare workers. And now anyone with a underlying medical condition that could place them at risk for COVID or not doing well should they contract COVID is eligible, as well as all kinds of frontline essential workers. So people who work in grocery stores, people who are our firemen, our police officers, our anyone who works in a job that deals with the public is at this point eligible to get vaccine.
So what are underlying conditions, Dr. Fegan?
So we don't like to think of all of these things as conditions, but if you're overweight, you're obese, you're at greater likelihood to have problems should you contract COVID. If you have high blood pressure, if you have diabetes, if you have heart disease, if you have elevated cholesterol, if you have asthma, if you're a smoker, these are all conditions that place you at risk to not do well should you contract COVID. And it's very hard for us to decide who will do well and who won't. And we try to think of all the things that we have identified as patients who struggle when they do get COVID. The majority of people who get COVID, we actually are able to send home, but we can't predict who's going to have more trouble and who's going to struggle. So we try to look at all health conditions that require you to take medication regularly, be monitored by a physician, and we know that those patients should get vaccinated.
All right, so we've moved on from the first phases of healthcare workers and those in long-term care facilities and essential workers and those over 65 to include those under 65 who have what we called underlying conditions. Is that where we are?
That's exactly where we are right now. So all those people are eligible. I know that they're still having some challenges in terms of getting appointments, but we're trying to vaccinate as many people as quickly as we can.
Okay. Can you tell us again the sources of information about vaccines?
Well, if you go to our website, which is vaccine, vaccine.cookcountyil.gov, you'll find if you're eligible, you can fill out the information, and we, schedule an appointment for yourself. But it also lets you know if you fall into a category that's eligible and helps you get an appointment and find a location to get an appointment.
Okay, vaccine with 2 C's dot
Yes.
cookcountyil.gov, G-O-V.
Exactly.
Okay, and there's a phone number?
Yes, they can call our toll-free number, which is 833-308-1988. 833-308-1988.
And there are 3 vaccines, Pfizer, Moderna, and Johnson & Johnson. What can you tell us about them?
Right, so the Pfizer and the Moderna vaccines were the first vaccines that we got, and people were worried about them. How did we put them together so quickly? And they thought they were developed too quickly and maybe they weren't safe. But these vaccines are safe and proven. We've actually been working on them for a number of years. The COVID virus is the same virus as the SARS virus that we saw in early 2002. And so we've been looking at this technology, which is newer than technology than what we used for developing vaccines in the past. This technology uses, particles from viruses, just from the nucleus, from the very smallest part, mRNA. And these vaccines have been proven now to be over 90% effective. Even after looking at that, we've been vaccinating people. We started these trials with these vaccines this past summer, and now with the experience we've gained started vaccinating our healthcare workers in December, and we now see that in the real world experience, both Moderna and Pfizer are over 90% effective in protecting those healthcare workers from getting infected when exposed to the virus. So it doesn't get much better than that. They both require 2 injections. The Pfizer requires 2 injections 3 weeks apart. The Moderna requires 2 injections 4 weeks apart. The latest, most recent vaccine to be released is the Johnson & Johnson vaccine. And that vaccine is only 1 injection. It uses the older technology. It uses parts of the virus the same way we make a flu vaccine or mumps and rubella vaccine. So it uses the older technology, and it is also very effective. The Johnson & Johnson vaccine was tested against some of the newer variants, the South African and Brazilian variants, and we know it is also very effective against the virus. So a lot of people say, well, I think I just want to get the Johnson & Johnson. You should get the vaccine that you can get an appointment for and get it, as soon as possible. You shouldn't worry about waiting for one as opposed to the other. They all work. They're all effective. We find that when we are polling people and trying to find out what their hesitancy about vaccine, they're worried about side effects. So I can say that the vaccines trigger an immune response. It wakes up your immune system. And that as a result of that, people may feel weak or tired initially. Some people even may have a fever. Just as, babies, when they get their immunizations, may be cranky and have a fever. So we don't necessarily feel well the first, for 24 hours after the vaccine. But none of the side effects of the vaccine are anything compared to getting COVID. So we think that that's worth it. That not everyone has side effects. Those who do have them for a short period of time, 24 to 36 hours, and then they go away as quickly as they come. So All of the vaccines work. They're all effective. And there's nothing to fear about you cannot get COVID from the vaccine in any case.
All right, so the Pfizer and the Moderna are based on new technology. The Johnson & Johnson is based on old technology, but they're all effective. And as you point out, whatever vaccine is available, you should just take it.
That's exactly right.
All right. What do you need to do if you've been vaccinated? So I got my vaccine. I had Moderna. And on my second shot, I was okay for 24 hours, and then I got kind of sick for 3 hours, but then I was fine after that. And some people get sick maybe for a day, but as you point out, being uncomfortable for a day is infinitely better than struggling with the disease, as anybody who's had it will tell you. If we've been careful and we've been vaccinated, should we still be wearing our masks and washing our hands and keeping our distance?
Absolutely, absolutely. You know, it's an interesting thing, Toni, that we've had very, very little low evidence, very little incidence of influenza this past year. And we think it's because everybody's doing these mitigation strategies, because we're wearing masks and because we're washing our hands. One of the side effects of that is, or for benefits, is that people have not gotten the flu. But even if you've been vaccinated against the virus, against COVID, you need to continue to wear your mask, you need to continue to wash your hands, and you need to continue to keep social distance. The reason for this is that when I say something's over 90% effective, there is a small chance that you could become infected and be asymptomatic. And because you don't know the vaccine status of everyone you are exposed to, you want to protect everyone. You know, none of us are safe till all of us are safe. And so even though you've been vaccinated, there's a small chance you could get the virus and not be symptomatic and spread it to someone else. We're doing studies on this now to see whether the vaccine also protects you from spreading virus if you're infected and not symptomatic. But it's too soon for those studies to have results. And so it will be next year before we know that. In the meantime, we need to keep our masks. The masks are going to be with us for a while. We need to keep washing our hands. That's good practice anyway. And we need to still space ourselves apart. All of these things will protect everyone until everyone is vaccinated. And we expect that while President Biden has said that everyone should be eligible by May 1st to get vaccinated, it will still take a while for everyone to get through the system and get their vaccine. So we want to protect everyone. We don't want anyone to become infected, and you never know whether someone is as young as 18 or as old as 85, whether they could get the virus and die. So we want to protect all of the people we care about and all the people in our community.
Just for the benefit of our viewers, asymptomatic means you don't feel any symptom. You don't feel like you're sick, but you could nonetheless have the disease and spread it to other people. Your point, is that your point?
That's exactly right. So what we know is that a significant number of people get infected with the COVID virus and don't have symptoms from it. Now, there are two categories. There are people who never develop symptoms, and there are people who are spreading the virus before they develop symptoms. And that's why this virus has been so treacherous for everyone in our community, because most people who do become infected do not have symptoms for 24 to 48 hours. And it's during that time period when they have a high level of virus in their body and that they have the potential of spreading to a lot of other people. And so we protect each other by wearing masks and assuming that everyone else could be infected without realizing it.
Right. And to your point, I mean, wearing masks has all kinds of benefits, not the least of which is that the regular flu has not killed its usual 40,000 people in this country, right?
That's correct.
And
flu has been killing that number of people every year for many, many years. And miraculously this year it has not happened. And I think it's because we're all doing the same things that protect us from COVID also happen to protect us from influenza.
Right, but we still have a terrible pandemic that we're struggling with, and President Biden and Vice President Harris had a memorial service marking 500,000 people who had perished in this country from the disease. So we're still facing a tremendous challenge. And can you talk a little bit about why the virus continues to be so treacherous? What about the mutations and what that means?
Well, so all viruses mutate. They change because viruses are about perpetuating themselves. And so the new variants of the COVID virus are even more contagious than the earlier variants that we first made vaccine against. It doesn't mean that the vaccine won't work against these variants. The vaccines are really targeted to the protein of the virus and are effective against that. But the virus has mutated to make itself more easily spread. And so as a result of that, there's a greater chance that someone who is infected, doesn't have symptoms, can spread it to more people in a shorter period of time. So we have to make sure that everyone continues to wear their masks so that we can protect each other. It's one of the things, and we passed. You note that President Biden and Vice President Harris had a memorial when we reached 500,000. We're over 550,000 people have now died, and in many states, and I think in 15 states already in the United States, we are seeing an uptick in the number of people infected again. Even though we're vaccinating more and more people, we're seeing that people have begun to relax their precautions, have been not wearing their mask as much, not washing their hands, and getting close together again. And it's too soon, because even though in most states we're up between 15 and 20% of the population have been vaccinated, that's not enough. We need to have more people vaccinated. And by not wearing those masks, we're seeing more and more people get sick again. And we're going to, try to avoid having another surge in Illinois and in Cook County. As you know, while the rest of the country had two surges, has had three surges, we've only had two. We actually were able to avoid the last surge that the rest of the country saw. And so we want to hold on to that. We want to get people to keep doing those practices for a little bit longer. Wear those masks and wash your hands and keep your distance. And let's see if we can avoid this, what would be a fourth surge for the country.
Yeah, but we've got a real challenge, I think, in what I call plague fatigue. That is, that people are tired of wearing their masks and washing their distance and not being able to see their friends and family and whatever. So what do you say to them?
I understand that. It's been a long year. It's been very hard, but we are so close. If we could hold on to these practices for maybe 2 more months, it will make such a huge difference, because in that time period, we think we will have many more people vaccinated, and it will become less and less of an issue. But it's still an issue now. And yeah, folks have been locked up in the house. It's been a long winter. It's getting warm outside, and they want to breathe free again. And we have to just hold our measure for just a little longer. It seems like such a long time, but it's less time than we have so far, right? So we've come through a whole year. We're trying to get 2 or 3 more months where we use these precautions. So there's the light at the end of the tunnel is close. It's a little while longer, not as long as we've had to do it so far, but a little while longer yet before we'll be out of the darkness.
All right. I've always been interested in world affairs, and this is a global pandemic, okay? And what I've suggested to people is it's not going away. A couple weeks ago, I read that there are 130 countries in the world in which not one person has gotten a vaccine. And that's 2.5 billion people in those 130 countries, by the way.
Right.
And as long as we have huge numbers of people in the world who are unvaccinated, the vaccine will continue to mutate, right? It'll spread and mutate. And it's important not only that we vaccinate our own people, but as a country that we contribute to the vaccinations of people around the world. As a public health specialist, you want to comment on my
Yeah,
theories?
that's exactly right. COVID is going to be with us for years to come. I was very distressed with how long it took us to get a single vaccine into sub-Saharan Africa, because people travel, and so it's spreading around the world. So yeah, the United States has to help the rest of the world get vaccine. And while we buy up a lot of vaccine, and I got concerned when we were buying more vaccine than we have people living in this country, that we need to make that vaccine available to other countries. And particularly these vaccines that are coming out now that don't require the special handling You know, the Pfizer and the Moderna both require freezers. While the Pfizer required a deep freezer, the Moderna required a regular freezer. But, you know, there are parts of the world where that's just not workable. So if you look at the tropics, you look at sub-Saharan Africa, you look at, you know, South America, they need vaccine that can just be handled with refrigeration and can tolerate being out for a day as we try to get it to people who are living in remote areas. But what has happened, even in Europe, where they have access to vaccine, is they were slow in their rollout, and people began to go out and socialize, and they've had to lock down again. So I think that the United States has had an advantage in that we were able to keep things in check for a longer period of time. But, you know, we're going to have to contribute to the rest of the world. Otherwise, you know, the vaccine does not know borders. I mean, the virus does not know borders. It will travel as people travel. And we're going to it's going to be a huge effort. It's going to take a long time.
Right. There's a fourth vaccine, AstraZeneca, which we had kind of stockpiled, although it's not been approved by the Federal Drug Administration for emergency use. And recently, the decision was made by the national government to share it with Mexico and Canada, which is a good thing. However, we've got to have a long-term strategy for vaccine production, and as you point out, sharing with the rest of the world, particularly places like South America and sub-Saharan Africa, where vaccination rates are very, very low, or there's no vaccine available at all.
Yeah, that's exactly right. And so we have to have a global approach, and I think it's something that the United Nations will have to look at in terms of how we're going to get vaccine into these areas where people are also not accepting the vaccine and are suspicious when you're trying to, you know, put needles into their arms for things that they're not clear about. But everyone understands that people die from COVID, and I think that we have a tremendous opportunity to lead in this capacity to make sure that the vaccine gets to the places it needs to go.
What's the one thing you'd like to leave our viewers with today?
I want people to remember that it's important still to wear our masks, wash our hands, and keep our distance, that we can keep everyone safe with those simple measures. As we roll out the vaccine to everyone, we want everyone to be safe, and that keep wearing that mask, keep washing your hands, and keep your distance, and we will get through this together.
All right, Dr. Fegan, let's remind folks about the sources of information about the vaccine.
Yes, they can call our toll-free number, which is 833-308-1988, 833-308-1988. Or they can go to our website at vaccine, vaccine.cookcountyil.gov. And they can find out information about the vaccine as well as make an appointment at the website or the phone number.
All right. Thank you very much, Dr. Fegan, for joining us today, and thank you for your good work in our health and hospital system. Thank you for tuning in to Health Hour. Remember, keep washing your hands, watching your distance, and wearing your mask. Every day, the light at the end of the tunnel gets just a little bit brighter, and we'll get through this together. Thank you.